Our next speaker is Sarah Chynoweth, a research fellow in the Honda Center for Human Rights. She's going to talk about sexual violence against men and boys in the Syria crisis, an exploratory study.
Great. Good afternoon, everyone. Thank you for having me. We're going to switch gears a little bit and move from India to the Middle East, specifically the Syria crisis. And I want to make sure I know how to use this properly. Okay, great. A little bit of background on this study. In 2016, UNHCR, the UN Refugee Agency, commissioned a study on sexual violence against men and boys in the Syria crisis. We knew that there was widespread sexual violence against women and girls, but we didn't know what was happening with men and boys, and we didn't know if there were services available for them, for male survivors, or whether or not they were accessing these services. So that was the impetus for this study. Because there was such little data before we went into the field, it was designed as an exploratory study. Are men and boys being subject to sexual violence? If so, who's doing this? Under what conditions? What's the impact? Syria was too insecure for me to enter, so I undertook data collection in Lebanon, Jordan, and Iraq, 3 surrounding countries. And the figures that you see here are the numbers of Syrian refugees those countries were hosting at the time of data collection. So there were 5 different methods, clearly a literature review. I developed an online survey for key informants, specifically aid workers that were responding to the crisis, to get a sense of their knowledge and attitudes before I went into the field. And then in October 2016, I spent a week in each country, a week in northern Iraq in the Kurdistan region, and then a week in Lebanon and a week in Jordan. And I met with 73 aid workers from 33 different agencies, from big UN agencies to very small frontline agencies providing targeted services. I also met with close to 200 refugees, both men and women, and adolescents. And then I had a focus group discussion with a group of mental health actors in Jordan. In terms of the limitations of this study, it was difficult initially to identify survivors before going into the field. However, once I was in the field, a number of men spontaneously disclosed during focus group discussions or spoke to me afterwards. UNHCR provided a translator, so translation error is certainly a possibility, and there's relatively low online participation in the survey, 33 respondents out of 73 key informants, but they're aid workers. They don't have a lot of time. I thought 33 was fairly okay, but those findings should be interpreted cautiously. There were 4 clear patterns of sexual violence that emerged from the data. The first one was conflict-related sexual violence against men and boys within Syria. And so when I asked refugees about this issue, specifically men being targeted, they used language like, it is everywhere, all sides are doing this, it is happening all the time. They described that men and boys were subject to sexual violence in detention centers, particularly sexual torture. They described men and boys being targeted during home raids at checkpoints, and a phrase I heard over and over again throughout the 3 countries was, they rape everyone. So during a home raid, armed groups or soldiers would not just rape the women and girls, but they would rape the father and the son as well. They were primarily second-hand accounts. The majority of refugees that I met with had second-hand accounts, so about a brother, a husband, a son, and then I've recorded 9 first-hand accounts of men who had experienced sexual violence directly. The scope is really hard to get a sense. Clearly, this is an exploratory study, but I did ask a group of women in Zatri camp. Zatri camp is a very large camp in Jordan with tens of thousands of Syrian refugees. And I was speaking to this group of women and asked them, because they had a number of stories, and I spontaneously asked them, well, what percentage of men and boys in this camp do you think underwent sexual violence in Syria? And they discussed amongst themselves, and they said, well, maybe 30 to 40%. Clearly, that's not quantitatively derived, but it may shed light on possible prevalence. The second pattern that emerged was sexual violence against LGBT persons, so sexual and gender minorities. I met with a number of LGBT refugees. They described that before the war happened in Syria, LGBT people were targeted for sexual violence and physical violence. And then when the war happened, it drastically escalated. As refugees, they described just this overwhelming vulnerability to sexual victimization in many parts of their life. All of them had been undergone sexual violence multiple times. They described being assaulted by neighbors, landlords, taxi drivers, other refugees. Their vulnerability to sexual violence was staggering. The third pattern that emerged was sexual abuse of boys, oftentimes by older boys in the community, as well as adult men, both refugee men and men from the host communities, and then sexual exploitation of men and boys. And this was actually what surprised me the most. Men described sexual exploitation in the context of work. So many men and adolescent boys are working informally under the table. And so they're working in the fields, they're working in factories, it's construction, and they would describe how when they would ask for their wages, their boss would say, but you have to do something for me first, or you have to do something for me and my friend first. I documented a number of other types of sexual violence that doesn't fit these four patterns. This just needs much more attention. Again, this is a small exploratory study. It is quite likely that sexual violence is operating and occurring systematically under other conditions as well. GBV IMS stands for Gender-Based Violence Information Management System. So humanitarian actors have at the national level a database. So all the humanitarian agencies that are providing services, gender-based violence services, they will record into this database what type of survivors have presented and what type of gender-based violence they experience. This data in no way provides total incidence or prevalence, but it does give some insight into at least who's reporting what type of violence. So in Lebanon, we had, of all the incidents of rape in Lebanon in 2015, among refugees specifically, 22% were reported by men and boys. In Jordan, over a 2-year period, the percentage of rape and sexual assault was 15% were reported by men and boys. Men and boys actually have more barriers to accessing services, so this proportion may be higher. In Iraq, there were no reports, which mainly describes that men are not coming forward to seek care. There were multiple impacts, multidimensional impacts that went beyond the survivor that have impacted their families, their communities, women and girls. In terms of the physical health, people described rectal trauma and rectal fissures, often the result of sexual torture. This requires specialized surgery to repair. Genital trauma and genital mutilation was also reported, and STI, sexually transmitted infections as well. I just want to say something really quickly about women and girls. It was oftentimes the women coming forward asking for services for their husbands, and they often described, look, my husband was arrested by ISIS, by al-Nusra, by the government. He was taken away, and he was raped, and he came back and he initiated domestic violence, or he's unable to work because he has rectal trauma and he can't lift anything. And so now we are at the verge of poverty, where my daughters can't get married because my husband was raped. So the implications really go beyond the survivor and impact the family as well. In terms of health service availability, just very broadly, services for boys are largely in place for, I have 1 minute, okay. Services for boys are largely in place in Jordan and Lebanon, very limited for men. In Iraq, clinical management of rape and health services for survivors is very limited for both men and women. Access barriers are multiple. There were death threats for men coming forward. I met with doctors and nurses who actually laughed out loud at the thought of a man being raped, saying, how can that happen? Men can't be raped. So there are numerous access barriers. So in conclusion, these findings indicate that men and boys are indeed subjected to sexual violence both in Syria and in displacement. The scope is really unknown, but these indicate that it may be more common than we initially thought. Health services are, especially for male survivors, are relatively scarce, and certainly the barriers are high to accessing care. At the very least, more research is warranted to look at this issue. This is the report I wrote for UNHCR. It's on RefWorld. You can check it out if you like. And in terms of building on this research, I'm collaborating with the Women's Refugee Commission, a think tank based in New York, to develop a global initiative on addressing sexual violence against men and boys, because it's happening not just in Syria, but in many conflicts around the world. Thank you. Happy to answer any questions.
Microphone's always too tall after Steve's been at it. So thank you for bringing this really important thing to light. Boys, I don't know much about Syria and their social mores, but if you look at Afghanistan, where having boy sex slaves is actually a fairly common cultural practice. So when you evaluate with boys, how do you assess what the standard, I don't know, the cultural mores are about sex with boys? Now, all of us would say sex with a child is rape, but clearly in these cultures, this seems to have been embedded.
I would say that there are a few different things here. One is that the Bacha Bazi boys are specific to Afghanistan. That's not occurring in Syria and the Middle East, as far as I'm concerned, as far as I know. There's some evidence that shows that sexual abuse of boys is more common than sexual abuse of girls, mainly because the boys have more access, girls are more protected. So they are inside, boys are outside, engaging with the world, potentially opening themselves up to perpetration. In terms of acceptability, it is extremely taboo and not socially acceptable. And a lot of the violence that we saw was in part just conflict related, so meant to destroy and undermine. Yeah, does that answer your question?
Yeah,
so I don't really see the social piece coming in as much. Yeah.
Thanks.
Hello. Thank you for the great work. My question is, to what extent are these incidences motivated by whatever the political scene is, and to what extent it's motivated by just personal power dynamics, like I have more power over you, hence I'll exert like some sort of sexual violence?
Yeah, that's a great question. I would say in Syria, it appears to be used as a tool by all parties to conflict. At least that's what was reported. So sexual violence is used against communities because it's really effective to either rape a man or a woman. It's soul destroying in many ways. And so I think within Syria, it is being used as a tool, as a strategy. In displacement, it's particularly with LGBT communities, they're seen as accessible and vulnerable, and they don't have legal protections, and so they're easy. They're easy targets, and perpetrators know this. Yeah. Thank you. Great. Thank you very much.